Okay, Parham, we are on live. Give me a second. Let me get the TikTok folks on, and then I'll say hi to everybody.
Better efficacy, and it's very important.
Okay, go live. 3, 2. Hey, TikTok, how are you guys? I am on live with Parham Namatola, my counterpart on the Sunday show. Please, as usual, as I always tell you, go on the channel, Dr. B Addiction Recovery, and you can come up there and ask your questions. I won't be answering questions on TikTok, but I am running it for those of you that cannot get to the channel. Dr. B Addiction Recovery, me and Parham Namatola. He has so that's, and let me say hi to these guys now. Hey guys, how are you? Welcome back to the show. Sorry, I'm multitasking here, and Sundays are a little hectic for me. We are back today. Thank you everybody for coming on. Parham, how are you?
I'm doing good, man. Really happy to be here for another Sunday with you and everyone that's been joining our live streams. It's really become one of my favorite things to do, and the community that we're building I'm just grateful to be a part of it, Doc.
Yeah, hopefully it grows. And I want to remind everybody out there, I was telling the TikTok folks today, look, we don't get paid for this. In fact, this whole channel is part of our nonprofit endeavor here at American Addiction. And Parham takes time out of his busy week. He runs his own treatment center. He's part owner of a large treatment center in town. I've known him a long time, one of the few people I respect. And you're going to get your questions answered here. Take advantage of it. Utilize, I think Nicole has put up a poll thing on this channel for you guys to be able to go on there and see what you want to talk about. So utilize it, and don't forget to like and subscribe. I want to make a general announcement also to everyone else. I have kind of kicked off my deep dive series, which I'd like to start off, which I wanted to start off with stimulants. I have started it off with stimulants. And the first one, I think, is what is GAT, which is a plant. And for the next few weeks, you're going to see me go into all kinds of stuff. Amphetamines, methamphetamines, the history of them, how they all cross paths, cocaine. It goes on and on. So keep an eye for that. Press like and subscribe, and let's get started. Parham, today's topic is, I think you guys and Nicole kind of, they did a poll. This is what people want.
Yeah, I believe that's how it happened. So one thing that we urged you guys to do last week is if there's anything that you want us to talk about, anything you want Dr. B, myself to cover, address, feel free to respond to the poll. And you guys spoke, and it seemed like benzodiazepine and the various type of withdrawal effects, and just in terms of the impact that it has, was something you wanted to talk about. Doctor can obviously cover a lot of stuff down his wheelhouse, and I'll do my best to cover any psychosocial stressors that's relating to underlying anxiety on a clinical aspect that could be addressed. So I look forward to this. And just real quickly, for anyone watching this for the first time, I really strongly urge you to go watch our previous live streams on Dr. B's YouTube channel, same place that you're watching this right now. It's been interesting. Last week we talked about human trafficking and substance abuse. The week before that was about Brett Favre and prescription medication. The week before that was about DMX, who passed away not too long ago, and we really took a deep dive into his life and trauma. Before that, we addressed stigma and how to break the stigma of mental health, addiction, treatment. We talked about the 4 Good Days trailer the week before that, which was a Mila Kunis movie that was really awesome about family dynamics, and talked about the Vivitrol shot, and we really took a deep dive there. And before that, we talked about marijuana and harm reduction, and is it a form of harm reduction? And we really distinguished between the different populations who use that medication. And then before that was enabling versus empowering, really, really good for family systems. And the first one was the link between anxiety and addiction, which I think we're coming a little full circle, because a lot of the conversation today is going to link back to that first talk. So please go watch all of those videos. There's so much valuable content in there. And then like and subscribe them, and really continue to follow and support us, because we'll do our best to do the same for you.
Yeah, thank you. Thank you for that, Parham. And we can get kind of dive deep into this. And you want me to start the opening?
100%.
Yeah, sure. Yeah. So benzodiazepine, both abuse and dependence and acute and long-term effects sort of have taken a little bit of a backseat to the poster child of the media in terms of addiction, and that's the opiate epidemic. Okay. And I think in 2019, over 90 million scripts of benzos were written. It's one of the, maybe the most, but one of the top prescribed psychiatric medications anywhere around. And I will use this recent event last year. I think the FDA really looked at the black box warning. I don't know if they went through with it for a few reasons. Number one, they said, this is a problem. We need to really reevaluate the risk benefit assessment before we scribe to the patients. And I was so blown away by reading the fact that they finally said, and we need to take patient stories more seriously about this protracted withdrawal thing. One of the long issues, I'll give a little bit of a historical thing, and I'll watch how much I talk here. If we kind of look at the history of this stuff, before benzos really, first benzo was kind of in the 50s, but let me come up to the 70s. We were using barbiturates for sleep, anxiety, whatever it is. Barbiturates have a very narrow therapeutic index. What that means is giving enough medication to achieve clinical effect, and then to go higher from there where you can have toxic side effects is very narrow. So you have to be cautious. Benzos really started to be marketed in the 70s big time with Valium and all that stuff as the safe alternative to barbiturates across the planet. Okay. And they just started giving this to really, it was big with housewives, at that time across the whole globe. Just take it for sleep, take it for hysteria, take it for anxiety. And this really grew until they started to see there's a major problem here. In addition, nowadays, one of the main problems is practitioners were so relaxed and are relaxed with this stuff. You're really supposed to give this stuff for short term, 10 days to a couple of weeks with close monitoring of how much you're giving and why. And we didn't. Now we have thousands of people inappropriately that have been on this chronic medication. And when they come to you, and then all of a sudden a few things are happening. Doctors are just yanking them off, or they really don't have the skill to taper the person off appropriately. The treatment centers, because of the way the payment is set up, they do short tapers, and the FDA finally acknowledged, I've been doing this for years, that, each individual patient has to be evaluated individually. You have to do another risk-benefit assessment and consider your length of taper, months to years. I was so happy they said that, because this is we've been doing this for a long time, and we get a lot of these disasters and kind of road wrecks in our clinic. So it's a big deal, and people out, and this one can kill you. It's a sedative, hypnotic, everything from seizures to death, and the withdrawals are a nightmare. Not just the short-term ones, but once you get into the long-term withdrawal issue, this stuff is to have psychological and somatic symptoms, anxiety, right? And, these experiences, some of them, they used to argue that these are just the anxiety coming back. Wrong. These are new symptoms: hypersensitivity to sensory stimuli, hypersensitivity to auditory stimuli, depersonalization, derealization, hallucinations. I'm talking long term. So there's, I didn't really put this together in a formal way, but it's a big issue, and I'm familiar with it. And a lot of these people that originally got on it to talk about the mental health side, there was a lot of stuff going on, because what people don't understand is most of the things that this stuff is prescribed for is off-label. For example, as an antipsychotic, as a adjunct to antidepressant, PTSD, so you throw all of that stuff in there. People have a lot of mental health issues that are residual and were never really addressed, but sort of covered with this stuff. Now, people are being yanked off of it or on it for a long time, and the management is takes quite a bit of finesse and understanding of the medication. I just threw a whole bunch of stuff out there on this.
Yeah, no, I mean, obviously the parts about the medication itself and the effect of and the history, by the way, really good. Those Mama's Little Helpers, right? Is that what they used to call them?
Yeah.
Mama's Little Helpers. It was such an innocent, benign pill that everyone was taking, and you know what I've noticed is, as you guys know, I'm also a high school basketball coach, and so I also deal with adolescents a lot too. Is I've noticed, I don't know if it's a surge. This is just my perception, so there's no data or statistic that I'm saying based on this, doctor, but I've noticed that a lot of adolescents get put on anti-anxiety medications for adjustment problems, for being unable to manage and cope with some of the underlying anxiety that they have as a result of their life. Sometimes just being an adolescent is a really anxious state of living. It's very uncomfortable. It's very, it takes a lot of adjustment. If you go from school to school and you move around a lot and you're sitting in a classroom and you can't be comfortable in your own skin, you're having adjustment issues, you're having social anxiety issues, and you're having generalized anxiety, and you're going home and you can't focus. You go to the doctor with your mom and some doctor says, hey, maybe this benzodiazepine is going to help them, and sets them off on a not so innocent journey. I've also noticed that, like you said, it's meant for 10 days at a time, something like that. It's sometimes when there's a sudden, tragedy or loss, and a person's ability to self-regulate their emotions is so shook up that they really can't get back to equilibrium to get to baseline. And medication in the short term might work. However, if they continue to use that medication long term, and then all of a sudden their own ability to access their self-regulation of emotions starts to diminish, and they're unable to do it without the medication, that's where the rebounding effect, I think you were talking about on some level, the rebounding anxiety that happens when you stop the medication. It becomes very uncontrollable, very hard to manage. It usually leads the individual back to a relapse on some other type of substance. I've seen people reach for alcohol at very high dosages just to be able to handle their benzodiazepine withdrawal. I mean, I've seen that, working in the field. So there's a lot of stuff. And like you said, man, I'm one of those people. I like to go to the root cause of the anxiety. When and where did it all start? What was this medication originally prescribed for? Has that ever been addressed? And like you said, the medication is so powerful itself that it starts to create its own problems that aren't even related to the root cause later on with the withdrawal. So I'm sure the people watching this are on both sides of that. They started taking the medication for a reason. And later on, the medication, which was the cure, ended up becoming the problem in itself. So the thing that was supposed to help them is what's hurting them when not dealt with appropriately. And it sounds like, based on the chats that I'm watching, a lot of people are struggling with the way their physicians are working with them through this, dealing with them through this, the withdrawals they're going through. So I think there's going to be some fruitful conversations, Doc.
Yeah, this is one of those, I'm glad more doctors are prescribing Suboxone, but I wish people had extensive. I wish you could have more extensive training. This one's even worse because there's a few things. One, the stigma and judgment against, is this guy addicted? Okay, he is. So what? Okay. But the other thing is a complete lack of understanding of this medication when it is time to taper. And then there's also the issue of a categorical approach to every patient. That means, okay, so let's say she's on too high a dose. But, I have patients in my clinic. You have to adjust to your environment and your society. I have guys in my clinic that have been on this stuff for 20 years. Would I have started you on this 20 years ago? Probably not, maybe for short term. But now that he's on it, if he goes anywhere, they're going to yank him, right? And, it's a low dose. So what I do is I keep you, and I try to make sure nothing funny happens. And the people that you do start this medication on, There are few that are going to be long term, but you better be ready to regulate and monitor and educate on a regular basis with that patient, and always advise on let's do some potential alternative, including therapy. So this medication takes a lot of clinical acumen and a professional autonomous approach with knowledge to manage all around. In fact, it's tiring for me, and thank God Alexis is taking a lot of it over. But it just comes with so many issues, and people out there suffer, and it could be dangerous. Yeah, so that's what I think about it. Oh, we already got somebody on there. Sure, Brandy's on. I'll bring her on, huh?
Sure.
Okay, Randy, come on. Hi, Randy.
Hey, remember me? We've talked before.
Yeah, how are you?
Well, scared to death, really. Let me just. I have you on one screen while I was StreamYard, so because I didn't want to miss a thing that you were saying, because this is my bread and butter. This is my struggle. So, knowing what I know is a double-edged sword. So it's awesome to be informed, because I'm smart enough not to do anything too rapidly. But I mean, the terror that is involved, because I'm already, I've been sitting in tolerance for a really long time, because I'm terrified of starting a taper, because I'm starting from an unstable place already. So I feel like if I'm already unstable because I've been sitting in tolerance for so long, am I setting myself up to fail? Because I'm all like, and then a two-parter question is my prescriber wants to stabilize me on Lamictal before starting a taper. I don't know how you feel about that. I don't necessarily trust her, so I would love a more informed opinion if stabilizing, if Lamictal could help with withdrawal.
So what is her? Yeah. Again, I don't want to give medical advice. I'm just curious. What is the indication for putting you on Lamictal?
Because, she thinks that I need to be stabilized on something, because, since long-term use of the Xanax, I am now unstable. I mean, I was stable before, and I was using it, as needed for what I needed it for. And
yeah.
Then,
can you tell me your? Yeah. Can you tell me your dose of Xanax?
I am prescribed 1.25 3 times a day.
Yeah.
So I would say anywhere from 3 to 4, minimum 3 milligrams, maximum 4 milligrams. I try to keep it as close to 3.25 as possible.
Yeah. And are you on any other psychotropic medication?
She started me on the Lamictal, but I've only been on it for a week at 25 milligrams, because I sat on it for a really long time, just not taking it, because I didn't think it was the answer. But I couldn't live in my skin anymore. I'm like, I have to do something.
Well, why couldn't you live in your skin? Because you were having withdrawals, or because of?
Yeah, because once I started taking it 3 times a day, it became a physical dependence thing, and then.
But you haven't cut down yet, right?
No, I haven't cut down yet, because once I told her, when I was at 1 milligram 3 times a day, and I said, I feel horrible. She's like, well, we can move you to 1.25, because for whatever reason, as long as it doesn't hit 4 milligrams, I guess it's okay to them.
Yeah, I mean, I don't know enough about the case. I certainly would. I wouldn't start somebody on Lamictal. That's it's a good medication. It's an amazing medication for some. I don't like it because it can have really toxic side effects, and you have to follow it, and you gotta. I mean, look, again. I don't know what the reasoning is. So
the only reasoning is because she thinks I need to be stabilized, and like my choices for stabilization would be going up in benzos, or trying me on something else. And the whole reason why I wound up where I'm at with the benzos is because I have adverse reactions to antidepressant type medications. Like I'm not,
Yeah.
SSRIs do not agree with me. And
Yeah,
so,
but as far as stabilizing, what I would do is cross you over to a long-acting benzo and even bump up that equivalent dose a little bit to keep you comfortable. And instead of aiming for, let's say, I'm going to keep it under 3, I would hit you at a comfortable dose where there is potentially psychological anxiety, but not physical withdrawals. That's a very key thing to be able to differentiate psychological versus physical issues. So I would just simply do let's say I ended up with 1 milligram of Klonopin twice a day. Okay, so first I would stabilize you on that for a week, make sure all the issues are there, and then I would start shaving off of it. And if it takes 3 years, that's what it takes. And it's pretty much that simple, because once you look, I got a person right now from the other side of the country with me. She came to me at, this is a person that's been using for years, poly substances, and her equivalent dose of Xanax. You want me to tell you what it was when she got 30 to 35 milligrams a day.
Okay. Of Xanax?
Yeah, I mean, I get this stuff. Not every day, but I've had many of these. So right now we have her on and so in this one I chopped it up. Xanax equivalent. It was a mix of Klonopin and Xanax. So I've chopped it up where my baseline is Klonopin, and I've cut down the Xanax. That will go first, then the Klonopin, and we are down, I think, to an equivalency of just in 4 months. We're down. I think she's down to about 18 milligrams a day.
Holy wow. Comfortably?
Yeah, she's and you don't even know the half of it. She has cut her stimulant use in over half, and switched to long-term Adderall. I'm going to take a couple of years to do this. So it's about the way you approach it and hand it to the patient. So that's my thoughts on it. But talk to your provider, Randy, and keep us informed.
That's the problem. My provider has led me in the wrong direction. My provider is the one who had no problem upping me when I said, this is bad, and then her answer to that is, well, let's put you on Lamictal. We'll slowly get you up on Lamictal until you're stabilized. And then I looked at it as, well, she must know what she's talking about, because she must know that that will help me get off the Xanax. Like it was like she sold it as a safer alternative. Like, let's get you on the Lamictal so we can get you off the Xanax.
Yeah. Lamictal is a mood stabilizer, and there's no data that supports using Lamictal to get you off of benzo. But again, that's a general answer. So.
But she's only a med manager. She doesn't have a lot of experience. She doesn't have a lot of experience getting people off benzos. So, I don't know what she's going on. I think she was just looking at, well, I don't seem to tolerate SSRI type medications well. So what else can we throw at her so that, we get her anxiety under control, where, probably most of my anxiety at this point is just rebound anxiety from, my body used to getting that steady stream of the benzo.
Potentially, but don't underestimate the value of things like Parham. What do you think? Mindfulness. I was just going over it the other day with somebody, a good therapist that can.
I think Randy. Were you the one that we were talking a few weeks ago, and your therapist? You guys were just having sessions that you would just kind of shoot the shit and talk.
Yeah.
Okay.
You remember me?
Yeah. Where did you get with that progress in regards to finding a therapeutic outlet that you're actually benefiting from more than just kind of like a friend almost?
I didn't get anywhere because I don't have the balls to break up with him and say, you're not doing it for me and I need someone else. So I really didn't get anywhere. And
Okay, so my suggestion is going to be the exact same suggestion I had for you a few weeks ago, which is good. That means it's consistent, feedback. And the consistent feedback is in order to kind of have a breakthrough with your current state when it relates to your anxiety, your coping, even some of the physiological withdrawal effects you're going to be able to talk to someone at the level of therapeutic intervention. And then also the other like self-care stuff, it's being able to really, really manage yourself and go on walks and be able to breathe in oxygen. And there's a lot of stuff that goes into the medication piece that has to be included. And when it's all included, also your support, who do you have for support and how connected are you to them? There's a lot of factors that go in. So I understand the primary intention, the purpose of this call was to talk about the Xanax and talk about the titration and the withdrawal and the possible limictal.
Just knowing what I know, like it's almost like I wish I didn't know what withdrawal looks like and what it has the potential to be, because with the acute and the post-acute and the protracted and knowing what comes along with it and knowing how long I've been on it and how steadily my dose increased. Like once upon a time it was once a day just to sleep, and then
I remember.
So like the fact that now it's been like years in the making, and several years in the making, and you can go up a whole lot quicker than you can come down. And I've seen too many horror stories. I know too many horror stories, and that is adding to the trauma. Like I have so much fear surrounding the taper, because unless somebody can tell me that like tolerance is even worse than titrating off, because tolerance is killing me. And maybe that's why she offered the limictal, because tolerance, I'm like, I'm barely functional. Like I've just, now the anxiety is crippling, and it's depression as well, which wasn't before, I guess, because I'm just not myself. Like my whole brain chemistry is just so off kilter that like I'm just so dysregulated.
Randy, what state do you live in?
North Carolina.
Oh, do me a favor. This is I have no problems giving you feedback, and neither is Parham. Do you have our number, Nicole's number?
I do.
Yeah, this week, give a call to Nicole, and I'll give you a little bit more feedback here, because it's a complex thing, and
it is.
And we'll give you a little more feedback. But I really suggest you do the Parham stuff. Don't underestimate it.
Oh, I don't underestimate it. I have all those tools in my tool belt. I really do. I can't access them right now because I am so dysregulated, like chemically. Like, so
yeah, I get it.
Mindfulness and all that, like I can't sit with myself anymore because it is painful, like the turmoil, the angst or whatever. And like that's as a direct result, like, it's the same life circumstances, like nothing got worse. It's just, I can only attribute it to the overuse of the benzos.
Yeah, give a call. And this needs a, also there's some sensitive issues that we need to address. Give a call, and I'll touch base this week, but keep coming by every week and tell us your progress. But give a call and I'll give some feedback, okay?
Okay, and I don't know if you remember, but I even asked you about Dr. Coleman.
Yeah, I remember the antagonist, and did you call Coleman by any chance?
I haven't spoken to him directly. I never filled out the screeners. I just called and got their headquarters in Texas, and basically told them a little bit. But obviously, they're not going to say anything other than sliced bread.
Just hold off on all of that, then give a call and I'll give you some.
When's a good time to call? I know that it, like the 1-800 number says 24/7, but I'm sure Nicole's not manning the phones 24/7.
They're pretty amazing. The tough part is getting a hold of me, but she will carve out 10 minutes.
Okay, so just give her a call tomorrow and she'll find a way for me to talk to you.
Yeah, she's amazing. And
I know she is. I have spoken to her. Hi, Nicole.
And she gives me information, and she'll make it happen. Okay.
Okay. But so you're gonna guide me some more and be my guardian angel?
Well, I'm gonna give you 10 minutes of advice, and then we want to see you on here regularly.
I mean, you have. Aren't you sick of me yet?
Yeah, no, we want to keep seeing you. Okay.
I think this is my third time. I don't know. But yeah, I will. I will. I mean, I appreciate the offer. I'll get in touch. Hopefully, you know what, whatever is good for you, I will make myself available for you. And I don't know, Parham, if you want to be my new therapist.
Give Dr. B a call first. Well, baby steps. Baby steps.
Baby steps. If you ever come out, we'll take care of you. Yep, give her a call, and I look forward to it.
So do I, because I really just want off. I really just want off, and I'm scared to death because it's, you know, like this. I was afraid to even sit on this call now or live because it's a trigger warning, you know, because I know what could be involved in withdrawal. You know?
Sure.
But if there's a way that you can help me get off, that's not complete torture, that, you know, doesn't introduce akathisia and all the other things that I know too much about.
I'll give you some. Let's talk when we talk.
All right,
Okay.
I'll continue to listen to all your sage advice and take deep breaths. Nice diaphragmatic breathing.
Okay. All right. We'll see you soon.
Oh, you sure will. Okay.
Okay.
Bye.
Bye. Okay, Parham, we got a little problem which I knew we're going to hit. We have 1, 2, 3, 4, 5, 6, 7 people waiting to talk, and we got to figure this out. I do want everyone to have a chance, and I knew we are going to hit this issue. How do we do this? Katrina's next, and some of these, there's a lot of complex stuff here that we can't answer. I mean, should we limit it by time? I mean, you're smarter than me on all this stuff.
Yeah, I don't know if I'm smarter than you, but I think let's just have everyone know that we need to be mindful of time because there's other people that are also wanting to come speak to us. And let's just lead with that and see how they respond to that. And then from there, we can be a little bit more assertive if we need to be.
Okay, let's get going. I want everyone to get a chance. Katrina. Hi, Katrina. Hi.
There she is.
Yeah, she's frozen. Katrina, can you hear us?
Hi.
Hi. Please
I'm
go
really
ahead.
nervous, so I'm sorry.
Don't be nervous. But where are you from?
I've been on Clonopin for Michigan.
Michigan. Okay. All right.
So
go ahead.
It's
go ahead.
really hard, and
She's are you catching her, Parham?
No, it's breaking up on my end.
been on 5 milligrams of Clonopin for 17.
God, I feel horrible. Katrina, it's your connection is pretty bad. I think it's on your end. I wonder if I can get you right back on as soon as you come on, and I'll get you back. You want to try that, or is there anything you can do, Katrina, to fix your connection?
Let's try having her go out of the studio and come back in, and then we'll see how it goes from there. There's also a version of just trying the audio too, if the video is breaking.
I don't know what's.
Let me do this. Let me remove you and put you back in. Okay. Okay, you're back in. Katrina, I'll tell you what. Leave the broadcast. Oops, she's off. Okay, as soon as she comes, Katrina, as soon as you come on, we will bring you on, and we'll put her in the front. Here's Prad. Hi, Prad.
Hi, Dr. B. I am from India.
Hi.
Hi. So let me quickly tell you. My mother was prescribed Clonopin 0.5 because her legs were kind of restless when she falls asleep. Wakes up because of that. So this was about a couple of years back. She's been taking this for a couple of years, and she stopped taking it. Later, because I had COVID-19 and I was isolated, I felt really stressed out. I started taking this, and I went up to 0.75. Then I brought it down to 0.5. Then I brought it back down to 0.25. But from 0.25, I'm unable to reduce it. I'm feeling restless myself.
How long you been on the 0.25?
A couple of weeks to 3 weeks time.
Oh, and how quickly were you coming down?
I took 0.75 for 3 days. Then I took 0.5 for about 3 days. Then I was on 0.5 for about 3 weeks now. When I try to break that into two and take half of that, I'm having a kind of an anxiety that I never had before.
Yeah. So and do you have a doctor that's doing this with you?
No. I'm kind of embarrassed to say this. I took this only because of the stress that I was going through because of my COVID-19 isolation.
And are you sleeping okay?
I'm sleeping okay, yes.
Yeah, and you take the 0.25 once a day? Is that what you do?
Yeah, exactly.
And is there a 0.25 tablet? Is that what the size of the tablet is, milligrams wise?
Yes, that is the smallest one. So I've been trying to break that into half and take it, but then that's quite not working out. I tried for a week. So that's when I found your channel when I brought it down from 0.5 to 0.25 because they are two
No problem,
distinct.
Pride. Look, I'm not giving you a medical advice, but if a patient came to me and there's no other issues involved, I keep very close track of this. But let's say, in fact, I had a guy from Virginia, I think he worked for the NSA, who was in the same thing, just brilliant kid, like a Caltech from the East. But what I would do is, let's say, for example, some methods to approach this. This is what I would tell a patient. For example, it's 0.25. You get up in the morning, 9 a.m., you take it. All right, then you try to cut that in half to 0.0125, and you were doing that and it wasn't working out. Here's what I would do. I would cut it in half, and what I would try to do is stay at 0.25, but I would split the dose throughout the day. What does that do? And start lengthening the time. Let's say you take it at 9, but by 1 in the afternoon you got problems. All right, take the second part at 1. You can deal with that problem and extend that until you get to later in the evening where you have a 0.0125, 0.0125 twice a day spread apart. Once you're used to that, start working on the least needed dose, whether it's the morning or the night. And that's the way to approach this.
Okay, my least needed dose is the morning one. So I'll work it. Thanks a lot for that.
Okay. All right. Okay.
Yeah.
Okay. Thank you, Brad.
Thank you, bud.
You too. Thanks for Parham as
well. Before you go, please go see a doctor and validate my advice and see what they want to say. I got to tell you that, okay?
I wish I could, but then because of the kind of crisis India is in right now, doctors are preoccupied with COVID-19.
Yeah, I understand, but just telling you. Okay, bye-bye.
Thanks for that. Yeah, bye-bye.
Okay, let's go to Liberty. Oh, wait, Liberty. Sorry. I Liberty. I'm sorry. I gotta get. You're next. I gotta get Katrina. I feel horrible, and you are next, Liberty. I didn't mean to cut you off, man.
We'll get you back, Liberty.
Just hang in there. Katrina, hi. Are you okay? Are you back? Oh, this is horrible. I feel bad for Katrina.
I know.
She had a tough time.
I think so. I went to the mic and using that instead of the camera.
Okay.
Is that better?
Okay. We got you. Go ahead, Katrina. Talk to us. Michigan. That's all we got. You're from Michigan. Talk to us.
Okay. I'm really, really nervous and anxious. I have been on 3 years, and I was on
we are still
about 14 years, so a total of 17 years. Tolerance withdrawal, and it's awful. And my doctor, I talked to him Wednesday, and he won't help me.
Parham, what should we do? You think Nicole can help?
Yeah, it's not working on my end. It's breaking up. Katrina, we want you to know that I do understand you're anxious and you really want to share this with us right now. You're every other word pretty much is getting broken down, unfortunately. It's really hard for us to understand.
I am so sorry. I know this is difficult for you to get on here. I wonder if Nicole could text you and give you some pointers on how to get on. We totally want to hear your voice, and it's important to us. We just can't hear. Could we? I'm going to get you off, and Nicole, maybe you
I
can.
don't know what I'm doing wrong. I'm using my phone.
You might want to look at the bars, or I don't know if you have a. Oh, there's my buddy. Take a look at the bars and all that stuff. Nicole, can you give a little technical assistance to Katrina? Katrina, we really want to get you back on here. Don't give up. We want to hear you to give you some feedback, okay? And then Nicole will try and reach out. Hang in there, okay? We're here. Okay. Man, I didn't mean to cut you off, Liberty.
It's all good. I wanted to come on this episode because like I want to discuss basically like my positive experience being on like low dose diazepam, and that's not like to undermine anybody who's like having difficulties or anything, but basically like I want to try to keep this as short as possible. So like through like my 20s, I kind of like struggled with substance use disorder, and you know, so like I went back to school, and I'm about to graduate with a bachelor's in communication, and I was just like right about my second semester, I was just like crushed, and like I had been on benzos before and like tapered off, but it was just it just wasn't working. So like I went back on, but I was on like a dose that was like 10 milligrams. So it seemed like it was kind of high, and, you know, I was getting kind of like spacey. So my doctor kind of originally wanted to get me off. But anyway, long story short, we got me down to like 4 milligrams, and I'm like, I don't want to go any lower. Like, cause I could feel it at that point. Like I could feel it leaving my body. And he's like, yeah, I'm cool with this. So the only thing I noticed is like for the first year of being on like that 4 milligrams, I was like terrified. Like, is this guy gonna throw me under the bus? Like, you know, is he gonna like cut me off, or like, you know, what if the pharmacy doesn't have it that day or something? And it took me like a long time of working with the doctor to like realize like, okay, he's not gonna do that. And if something happens with the pharmacy, like he'll work it out. But there is like a weird relationship with the medicine where that happens, and it took me a long time to get comfortable.
Can I should I respond, Parham?
Oh, for sure. Yeah, I have a few things to say too, but this is great.
Yeah, Liberty, that feedback is rock star feedback, because if you go to my YouTube videos on this medicine, I talk about that. And one of the things I talk about is just what you just said. The relationship the patient has on with this medicine, especially any thoughts of a taper, is the most frightening, horrifying, mortifying thing in the world to them. So what I do, and I point that out, and so that is some sort of a connection to this medicine that has a grasp on people. And one of the things I emphasize, and I think it's all of my video on YouTube on the tapers, I do a couple of things. Number one, I absolutely, I'll wait 8 months before I suggest a taper to someone that's come to me, because I need to know that me and that patient are down. We have a rapport. We trust that person needs to trust me, because as far as they're concerned, I have their life in my hands. And once we get to there, then they got to make that next small leap. They got to understand, I am not going to abandon you. And once we start the taper in the way that we do it, and they see that they have a lot of control over this medication, it's one more step of empowerment for a really odd relationship that is very different than other drugs. And you nailed it. And some people get to a point, and you just got to keep them there and address this later with constant education and revalidation and sort of affirming and letting them know the risks, the benefits, where we are. I'm not going to cut you off. Always think about it, so forth. But thank you for pointing that out. Parham, please go ahead.
Yeah, Liberty, what I want to say is also thank you for your feedback, and here's why. So first of all, as a human being that's overcame a substance use disorder in your early 20s that probably had you go to treatment, and I'm sure those were really dark and really dim days in your life, to the man you are right now saying, hey, I'm about to graduate with a bachelor's degree in communication, that is badass, you know? So not myself, not Dr. B, not anybody that has any type of clinical knowledge or understanding about like progress and improvement and healing in life would ever say, hey, this medication is bad for you, because, hey, in your story, man, this is actually working out really well for you. So I want you to know that there's no judgment here with a human being that's taking a medication and improving their lives. And I'm a person, by the way, I'm a partner of a treatment facility. So and from my world to your world, I'm telling you that, hey, I'm proud of you, man. That's some really good stuff. And that's a beautiful story. And and there might be another person out there, another Liberty out there that might hear you right now and say, shit, maybe if I continue on the path I'm going on right now, I can overcome the substance use disorder and find my version of recovery. You know, your version of recovery might be different than my version of recovery, and mine might be different than someone else on the side chat. But keep on doing what you're doing. You know, that the progression that you have to go through from going through the different stages of adjustment and adaptation and fear and overcoming all that to seems like you got a pretty good footing right now. So keep doing whatever you're doing, my friend. Stay away from the stuff that you know triggered that substance use disorder in the past. Stay away from the people and places and all that kind of stuff that you know exists in that world. Keep surrounding yourself with people that are also getting bachelor's degrees and moving forward in life, and you know, come back and give us a story after you graduated, you know, about what you're doing next.
Yeah, definitely. And thanks for having me on. I appreciate it.
Yeah, but our pleasure, Liberty. Keep us updated and let us know. Okay, buddy?
All right, take care.
Thank you. Bye. All right. Let's get Octavian on. What a badass name. Octavian.
Hello, can you hear me?
Yeah,
Yep.
I love that name.
Thank you. It's not made up or anything.
No, I'm sure it's not.
I wasn't expecting to do this today. I was just browsing to YouTube and I saw you on, so I thought, well, why not? I've seen a couple of your videos and I think that's why it was recommended today. So I've been taking clonazepam for about 20 years. It was prescribed to me lawfully, I guess. In the emergency room, I went in with some other issues, and my blood pressure was very, very high. I was 33, 32 at the time, and my blood pressure was around 225 over 120. And the doctor there suggested that I take something, you know, for the blood pressure. And there was another doctor listening in and said, you know, like, I think he's really stressed. Let's try him out on clonazepam. And they gave me about 2 milligrams. I've never taken that thing before, and I was just flying within, like, I don't know, maybe half an hour, 45 minutes. And then my blood pressure was 90 over 60 after that. So they kept me on clonazepam for a long time, just for my blood pressure and anxiety. So I never knew, you know, I had like this many issues. Clonazepam. It was about maybe 8 years ago that I started to try and wean off from it. I was taking about 4 milligrams a day. And I by then I just used it to fall asleep and to feel normal, because if I missed a day, I would feel horrible. I mean, horrible. I didn't know who I was. I couldn't think. I was having panic attacks. And I've actually brought it down to 1 milligram. That's what I take a day. But I have a new doctor. The previous doctor was always, you know, like like any problem I used to come in, he said, you know, I think we should probably raise your clonazepam. So that's how we fixed anything that was wrong with me. But now I have a new doctor, and he's not, you know, a proponent of like clonazepam. So he just thinks I should cut off, like, you know, stop taking it, that the amount I take is not too high. But let me tell you, if I go off of it, I know you were talking about, you know, like sometimes I have to wear earplugs in my ears because, you know, the noises, you know, that, you know, are normal to other people. I mean, they're overwhelming to me. I have to be in a dark room sometimes. It's it's just intolerable. So I just wanted maybe some advice as to how to go about. I read a little bit about it, and then I think you do recommend in some cases, perhaps going into a different benzo, like diazepam, and then start cutting it off like that. I'm not sure, but
You said you're on Klonopin?
yeah, the clonazepam, yeah.
Oh, in fact, Parham, this is something you may or may not know. A lot of people don't know this. It's not the other benzo that's rapidly acting besides Xanax that has a high abuse potential is Valium. And I don't know if a lot of people know that, but Klonopin is good. Actually, that's what you're supposed to be on. Octavian, it's hard to, the only thing, are you in the States?
No, I'm in Canada.
Oh, okay. Yeah. Okay. So I think so that is not a monster dose. The question for me would always be why and you take the 1 milligram once a day?
Once a day, yeah. I take it up just before bed.
And I don't know what the original problem was. And this becomes, so here's how I would approach this as a clinician. We would have to look at how long you've been taking it. What does it do for you at this point, right? Because now we're into this for
it really
years.
does nothing. It just basically keeps me normal. I don't think it does much of anything.
But before starting to take it, everything was okay?
Well, like I said, I had some acute events, that sent me to the hospital. And I think, like I was given that for anxiety, which they thought was causing, which it was. I mean, I was pretty anxious. I was having like a lot of anxiety. Like my blood pressure was the thing that they were most concerned about. And then my regular doctor said, well, it's better safety profile in this medication than, the antihypertensives. So let's keep you on that.
Yeah, that's an odd approach, but here's what I will have to say. If I was your physician, the conversation I would have with you is always number one, the mental health component, and if there is a need and how that can help. That is crucial. But as far as this go, I would say, Octavian, let's take a look at this. Let's look at the short-term and long-term risk-benefit 1 milligram Klonopin a night. Okay, obviously, at the most basic level, taking a pill is a negative. Taking anything is a negative, right? So that part of it is. Two, we actually don't still know the long-term effects of stuff, except the effects it have on the elderly in terms of it increases rates of false memory, all that stuff. But we don't have anything definitive in terms of saying it causes dementia. Nevertheless, your body has now built a really good physiological, at the very least, dependence on this. And I would have, if you got a cool doctor, I would have this discussion with the doctor and consider a slow, very mild taper to see if you can get off of this without, and again, when I say slow and mild, I mean anywhere from 3 months to 3 years, right? To start slightly cutting back.
I tried that before. Sorry to interrupt. I tried like a few years ago cutting back, and I made it to 0.25. And I was like that for maybe about 3 months. And then I just started feeling bad. So I think the symptoms of like the anxiety and panic attacks that were coming, which I never had before, drove me back to going back, and I think, the dosage which I feel pretty well comfortable with now, and it's the one at 1 milligram. If I go down a little bit, I start feeling, but I really haven't tried it again for quite a while, a few years.
Then that itself will be the discussion. There's nothing wrong with trying again, because your physiology is always changing, your plasticity and so forth. And again, the mental health is key, because and I'll let Power, because who knows where you're at today versus 3 years ago. We are always changing as psychological, behavioral, and emotional specimens. And that means the interaction in the brain changes. I'll let Parham add to that. And then if you have a cool doctor and you want to, and you guys decide, you can try again and then come back up. And so it should never be rigid. and there should always be plasticity and flexibility. Parham, please go ahead. I think you were going to say something.
Yeah, Octavian, that's what I was going to say was, first of all, I understand that you tried a few years ago and you were able to get down to 0.25, but the anxiety and the panic attacks and some rebounding stuff happened that it was a little bit intolerable, a little overwhelming, and you decided to kind of go back to the route you were on. So my suggestion to you this time around, if you do choose to try this again, to titrate down, is to see what you didn't do last time, right? What components did you not include into your titration regarding mental health or regarding breathing or regarding some type of walking movement or meditation or some type of talk therapy or journaling or whatever it was, the change in holistic diet. What didn't you do last time? Include those into it this time to see. Now you're going to have two different versions, right? You're going to have the previous version A and version B, and you'll be able to see in adjustments in real times if it's helping, if it's improving, if it's making it a little bit easier. My gut feeling and my initial thought is that it will make it easier than it was last time. Okay?
Well, that's where I'm at right now, and thank you for that advice, Parham. I have been taking classes and actually for many years now. In fact, I'm even teaching it in mindfulness.
Okay.
So, and I have changed my diet, the way I live, and my approach to things, and to the way I handle perhaps stressful events.
Sure.
That's why I'm at a point where I feel maybe I should be trying this again.
Absolutely, man.
And what Octavian, what Parham just said, I see all the time. People always come. And whatever change it is, they're like, "Oh, I did that this year ago," and I'm like, "Okay, let's try again." We can always go back, and pretty much 90%, well, 90 more than 90% of the time it works. And and so what he's saying is gold, and you can do it. And again, if it doesn't work, you can give it a try later. Always, the clinician should have risk-benefit analysis and ready to change with you at the center of the decision-making. And so I hope that helps.
Oh, it does. Thank you. So I'm glad you didn't say, the switching to a different benzo.
No, you're on a good benzo.
Okay.
How come you haven't subscribed to our channel? You said this just popped out because
I've just been looking at it, not too seriously. I know you came up, and I saw a couple of your posts on YouTube, and then I was looking at something else unrelated. I mean, something to COVID, and then you came up and it said you're live right now, and I go, well, maybe this is fate. I have to maybe talk to you. It was meant to be. So here I am talking to you, and I feel like I'm talking to some sort of like a movie star, because I've seen a lot of your videos.
Wow. Anything but that, but we appreciate it. Come back, let us know how it's going. We're trying to build a community here, man, and all the feedback. By the way, everybody, and not just you, Octavian, but everyone that comes on, this is education and empowerment for so many people out there. Hundreds and thousands will see this video later. The feedback you guys give, they take that much more than they might take it from me. And Parham has a lot of personal experience with some of this stuff, because you're the real deal. So your experiences and your feedback, and what we kind of give a little bit on top of, is gold. So you're actually helping people. So we love it. And
I'm glad.
Stay with us. All right.
Thank you very much. You guys, take care.
Thank you.
Appreciate it.
Take care.
Okay, Abe. Wow, these are some really cool stuff, huh?
Yeah, it's just cool to see how many people are trying to jump on and talk to us now. This is what we always wanted.
Yeah. Abe, how are you, man?
Hi, Dr. B. Hi, Parham. I'm doing good. Nothing. I'm just staying up late at night waiting to talk to you guys, because it's 3 a.m. here.
Oh, wow.
Oh, man. That's an honor, man. Thank you. Thank you for doing that.
Yeah, thank you.
I take time out on Mondays. So I stay up on Mondays to, it's Monday here, so I stay up to watch and join with you guys.
We appreciate that. Tell us how it's going and how you're doing.
So basically, the last the first time we talked, you told me that when I was going to quit, the inner feelings which I had tried to suppress when I just had started with my addiction, they would come back. Like they would boil up, the inner demons which we tried to suppress with using addict, like becoming an addict using drugs. So those inner demons, those pain points, they rose up again, and I made a list of them. So can I just run through them with you, because we're in a crunch for time. So can I just run them? And
Sure.
basically, last two sessions, I was really focused on listening. I just want to get some things across in this session and then listen to you guys afterwards. Is that fine with you guys?
Yeah, sure. Go ahead.
Okay. So basically, really quickly, if I can just list the things I noticed in myself. Wait, let me just find it. Huh. So basically, I am a child of divorce, basically. So my parents separated, and my father was very abusive. He used to physically beat me, and when I think about that stuff, I think that totally had an impact on my personality as I was growing up. Also, in India, domestic violence is very common. I have witnessed domestic violence and fights in my household as a child. Like I witnessed my father strangle my mother like to death. Like his fingerprints was on her neck. It was a very horrible time in my life. So I've uh, I've also suffered like financially because of my father. In the 2008 financial crisis, we lost our home. We had to sell off our house, our business, and we had to move. And that, then I think I had a kind of an oral fixation. I started eating a lot. I was a very obese child. So when I started eating a lot, I gained a lot of weight, and that I think caused my self-esteem and confidence issues in my teenage years. Because India is not like America. Fat shaming is very common here. Everybody will make fun of you if you are fat, and especially in an area where other people are fit and taller than you and all that. So then the other thing is, I'm an only child, so I have the entire weight of the responsibilities for myself, from my family. Like I am the only working adult, like working age adult. Also, I have some issues with self identity, and self hate, and I have suicidal ideation. Like I think about the process, not just I want to kill myself. I think about how I will kill myself. Like I have a plan. This is how I want to die if I will want to die. So this is all the heavy stuff that came up. I don't want to go on forward because it's getting kind of heavy. What would you like to say now?
Parham,
Yeah, Abe, thank you for sharing all of that with us. Each week, if you watch us, there's one thing I talk about, and that's adverse childhood experiences. And you've experienced many of them, many of them, which is the abuse from your father. Even watching your father abuse your mother is a form of childhood adversity and one of the adverse childhood experiences. Going through the body image issues and the self-esteem issues and being bullied, it really does impact one's self-esteem as a teenager. That's not just universal to India, my man. That happens all over the world. And whenever you use substances, especially being the primary breadwinner of the family and trying to support the family, the weight of the world is on your shoulders. So that's a really place that one experiences a lot of anxiety. So as soon as you put substances, I believe heroin was your drug of choice. As soon as you put in heroin into your body, all of a sudden it's like, I'm going to be okay. I'm going to feel.
It took the pressure off.
It takes the pressure off, man. It does magic for someone like you. However, we know enough about, you know enough about addiction. You know enough about heroin. You know enough about tolerance, withdrawal to know that the thing that's helping you actually becomes the problem. Hence getting on the station, talking to us each week, trying to figure out what you got to do. But I'm telling you, I know mental health services are not as common as maybe they are in the United States. But I strongly, strongly, strongly encourage you, whether there's support groups that are available to you. I don't know what type of support groups are available in India. I'm pretty sure there are some. Whether it's a provider that can get into some mental health, some group counseling, some individual counseling, because until, my friend, you address these underlying causes of your addiction, which is rooted in deep trauma and a lot of abandonment and divorce, by the way, is another adverse childhood experience. Until you address all of these things, the use of substances will always be an option because it's going to take off the edge, the pressure. It's going to make you feel okay in your own skin. So what you shared with us is a great starting point. You have a lot of information to go take that on to a professional or to a support group and start addressing those. It obviously can't be done in a call like this. I wouldn't be able
So
to.
what I'm trying is a family therapy. So the
Yeah.
issue of most of my problems is family related. So I have to talk through these things with my mother only. She's the best source who can help me with this. And she is very open minded and very positive minded about her past right now.
Yeah.
And her mentality is not like mine. She's a fighter, not like me.
Yeah,
I like
Abe, I want you to know you're a fighter too, man. I've never met somebody that struggles with addiction with intravenous IV use heroin from the age of 17, as I remembered, and they're still around today talking to us. That person is a fighter. I want you to know that. You might not see yourself that way, but I see you that way. And there's probably a lot of people that see you that way too on the side chat. So you are a fighter. However, family therapy with your mom probably won't be the best route to go. It's got to be with someone that doesn't have an emotional connection to you, because mom's going to love you the way moms love you. And you're going to need to talk to someone that's objective and doesn't have emotions connected to all the stories you're about to share with them. So that's the best I can do on this call. Thank you for staying up till 3 o'clock in the morning just to talk to us, man. That's an honor. And I look forward to hearing your journey as we move forward.
Keep us posted. Abe.
Can we get back to the medical side of things for a second and the topic of benzodiazepines? So,
Yeah, Abe, just because we have so many people on, I'm gonna because it just keeps going. So we're trying to keep it down.
just one tiny thing I would like to add. Like once you take Xanax, you have the memory loss thing. Once you take it, you try to keep you forget, you overdose, like you redose once you're high on Xanax. So I used to take Xanax and I used to wake up. I was like, I took 4 before sleeping. Where's the entire patta? Where's the entire strip of medicine gone? And it turns out in the morning I've taken like 15 pills of Xanax. So that's a thing I think people should worry about with Xanax.
Yeah, it's a part of whether it's a blackout or the anterograde amnesia. Yep, that's one of the acute things of Xanax. It's like taking down a whole bunch of alcohol. Thank you so much. So keep us updated, okay, man? Stay strong, and we're here for you.
Yeah, I'll leave you now. You have a lot of time. I'll just talk to you later next week. Bye bye.
Thank you. Bye-bye. Be safe.
Yeah, thank you.
Strong kid.
I've yet to meet someone that's strung out on dope or heroin or getting on hardcore benzodiazepines that doesn't have some type of underlying trauma in their life.
Yeah, it's always the same. These guys are tough. Hey, Zach, man, thanks for your patience. And Katrina, if you're out there, I hope you can get back on. We are thinking about you. Hi, Zach. How are you? Hello?
I'm doing all right. I'm hanging in there. So I feel like this is more of an appropriate stream than the Brett Favre stream that we did a couple weeks ago. But basically, where I'm at right now is my doctor is not really helping me with any kind of tapering whatsoever. So with the Suboxone, he's only going to taper me if I continue the benzos. So basically, I am at like a point where I'm flop with benzos. It'll be a higher dose, a lower dose, and basically, he'll only taper my Suboxone if I get a prescription. So I'm kind of struggling with that. I'm afraid of withdrawals. I'm afraid of seizures because I've had them before. I've had a grand mal seizure last year, and I just don't know like what to do with that situation.
Can you find a different? I think you were on 24 milligrams of subs and the benzos you were buying on the street. Can you find a different provider that's potentially more willing to work with you? I don't know.
Possibly, but I live in a county where there's a lot of meth heads, and I have a hard time finding work, even though I have like my resume and I have some job experience. I can't find a job for the life of me. So, and then another thing, we talked about me trying to get my car and my license back, but I can't do that if I'm spending the money on the pills. It's a very hard situation for me. Tomorrow, I just bought like a watch so that I could tell my blood pressure, because or not my blood pressure, my heart rate, because it's always high due to my anxiety. So, basically, yeah, I have a stash of medication, benzodiazepine medication for tapering. I know that I was told by my doctor that you can go down 0.5 milligrams on the Xanax every 3 days, I believe. I don't know if that's a
Yeah,
medical, you know.
it's not. And
So
my
I
response as
do
a patient.
have
No, no. My
license
question
now.
is, can you find a provider that will prescribe you both and then adjust the medication in a sober-minded fashion to get the right medication and right dose versus, excuse me, versus you tapering yourself off of the Xanax? Go ahead.
Yeah, I don't think so with my current situation, because I can't travel. I don't really, I can't drive, so I can't really travel. So my options are limited to the county I live in. So it's
What?
kind of hard.
Where are you?
So I have to kind of taper myself. I have to have the willpower to taper myself. And I don't want to go through the withdrawals. I feel the rebound anxiety. I hate it. Um, I had to take something today so that I could, feel okay. And I just feel tired. I feel like the pills aren't even working more, you know. So it's just this flip flop thing. The other day I took 4 and a Clonopin, and then today I've taken 1. It's just I don't, since my body isn't like adjusted to a certain dose, uh, I don't know if I'm going to experience extreme withdrawals, that being the long and short term, and then the starts with a P. I can't remember,
Protracted?
but yeah, I'm not
Post-acute?
really sure what's gonna happen with that proactive withdrawal.
Yeah.
Exactly. So I don't know. I would like to get off these pills if I can't get them prescribed to me. So I'm gonna have to figure out. I'm gonna have to gain the willpower to taper myself, because I am not getting any help tapering on my own.
Any thoughts, Parham? I mean, I can, it's just, yeah.
The only thought that pops in my head is I understand that the county is small, might not have a good reputation, but what state is this? California? What state are you in, Zach?
Yeah.
Yeah, so there are
I'm in
telehealth
California,
options.
and I do counseling. Yeah, I do counseling. I do group group sessions. I go to my doctor weekly.
I remember
I
that.
don't really know what more to do than that,
No, I do remember that.
AA
My
meetings. I
suggestion.
mean, I'm not an alcoholic, so I wouldn't.
Well, support groups in general could be helpful, even if it's not AA. Just in
Go ahead,
general,
sorry.
support groups are always good. Yeah, I was just going to say, when Dr. B was saying, would you be able to find another provider? Telehealth, when someone has a limitation with driving and someone is a primary caregiver for their grandmother, which I remember you were, you are able to meet with providers via telehealth, I believe. I don't think I'm overstepping, Doctor, am I? Is that an option?
I forgot it was California. I think he's in Northern California, actually. Is that where you're at?
He was a fire survivor. I remember that.
Yeah, it was way
Lake
up
County.
there. Yeah,
Yeah,
and I
live in
forgot
Lake
what-
County.
Yeah, and you have Medi-Cal, I presume, right?
Mhm, partnership. Yeah.
You have straight Medi-Cal?
It's
Can
a
you-
partnership Medi-Cal, so it's they pay for my prescriptions and they pay for my doctor visits, basically,
Do me a favor.
which is
Call
a
my
good thing because I wouldn't be able to. Yeah.
yeah. So a couple of things. There's Medi-Cal, which
Go
is from
ahead.
the
Sorry.
there's Medi-Cal, which is from the state, and then each county has carved out the contracts, and that's how providers make a little bit of money on this thing. Do me a favor, call my office Monday or Tuesday, and have them run your insurance card.
Okay.
We don't get too many of these, and we take them. I mean, I literally pay nothing. The issues, I don't really care. I just want to see if we can help you out here. Call my office Monday. Ask for Karina.
Yeah. Thank you.
And tell her that we've spoken, where you live, and just for her to run your. And the question is, can we take your straight Medi-Cal, not your local Medi-Cal? And I do know that we can certainly prescribe up there, and I'll tell you why.
Okay.
The reason I know that is because the medication comes from Sacramento approval, not local approval, to make it accessible for everybody. Call my office Monday, Zach. Maybe it just occurred to me that I can help you out, buddy.
Okay.
Since you're in California, okay?
Okay, great.
If that,
Thank you, Dr. B.
maybe we can figure out a way to
much
solve this.
appreciated.
Just so you know, Zach, you'll be seeing my amazing PA. You will see me, and I come up with the plan. But you'll be seeing Alexis. She is a rock star. But I'm always in the mix, and I got to tell that to people nowadays because the whole team is geared towards what we do here. So, but call and let's run it and see what we can do. Okay, buddy? Okay, Zach?
Okay, great. Thank you. Thank you, Dr.
Okay.
B. Thank you,
Okay.
Parham.
Bye.
All right.
Okay.
Goodbye.
Bye. Man, that kid's got it tough.
Yeah.
It's just so hard to. Okay, let's get to Roger. Roger, I think, is from South Africa. I don't know why I know that. I saw it somewhere. Am I right?
Hi, Dr. B. Can you hear me?
Hi. Yeah. Are
Yes,
you
we can hear you.
from South Africa?
Hi, Parham. How are you?
Good, man. Welcome.
Thank you guys so much for having me on. I've been a subscriber of Dr. B since last year. In 2017, I got introduced to benzos. I actually just had a panic attack. And what happened was one of the doctors prescribed me 91 milligram tablets of Ativan and said I must finish the course. And yeah, it was just very strange. And luckily, over the years, unfortunately, as you know, with the benzodiazepine, you start off with 1 milligram a day, then it goes to 2, 3. So unfortunately, I've got to a stage now where I'm taking around about 7.5 milligrams of Trankopam, which is also lorazepam, per day. So it's 1.25 in the morning, 2.5 at about 12, another 2.5 at about 6:30 or 7, and then 2.5 at night, 1.25 at night before I go to bed. So I was just wondering if you guys had any advice for me on how I could tape off safely, either sort of shifting to longer acting benzo or seeing a psychologist, as because what the doctors here are not really that helpful or clued up in terms of what to do in a benzo taper. And they also go to rehab center, go to this, do that, but I don't think that's the right way to approach this. I could be wrong, but any advice from you guys?
Is that an equivalent dose of Ativan? Tell me the name of it.
It's called Tranquipam.
Yeah,
It's exactly the same as Ativan. Yes,
it is
correct.
exact. So you tell me it's the same equivalent dose,
It's
right?
lorazepam. I don't have the bottle here.
Yeah.
Let me just check for you.
South Africa. Yeah. In fact, it's one of the few.
Yeah, it's definitely lorazepam. Yeah, that's it.
Yeah. If it's an equivalent dose, that's a huge dose, man.
I know that's the problem.
Okay, so there's some. Should I go ahead, Parham?
Oh, 100%. Yeah.
Yeah. So there's some good news and some bad news. How many years you been on that?
Since 2017, I was only on 3 milligrams a day. So
Are you in
2018, 2019, it sort of really increased, and then last year it got bad because I was also prescribed Oxynorm, which thankfully I stopped after 3 months because I know that's really bad for you, which is like an opioid kind of painkiller. So I've come off that, but the benzos are really hard. I'm trying to see how I can come off this, but it's a challenge.
So the good news about this. So again, I don't know your age, any other medical issues.
I'm 34.
34?
Yeah.
Okay. All right. And you're in Johannesburg?
Yes, sir.
Okay. All right. So in general, and please talk to your doctor about this. Well, just from what I know, minus not knowing anything else, my general thoughts on this is that the good thing about it is there's so many doses throughout the day. Okay. That's actually a good thing because you can, and I'll tell you why. Because we can pick a place to start shaving, right? Because what's so important in this is, instead of having spikes, I want an even thing in someone's blood when there's any sort of response. And so when you go down, some people, you look like a pretty tough cookie, but some people, I'm okay if you have a psychological reaction to this stuff. Remember the other patient came and told us about that? I can live. I can live with that a little bit. I don't want to live with the real physiological withdrawals. So what I would do is talk to your doctor, but he's got to be friendly about it and always ready to go up and down.
Yeah, doctor, that's the problem. My doctor is not so friendly. The one doctor even told me that you must stop benzos completely. You must just go on to stress them. And I was like, how can I just stop this thing completely? And I watched your video say that you must do a slow taper. Even Palmer, I mean, you can't just stop this cold turkey. It's very dangerous. I know I'm not 34, but I mean, I'm not that tough that I can.
No, that's dangerous. Then you got to find a clinician, and hopefully, what they do is, let's say you got like 5 doses throughout the day. I'll give you an example of what I would do if I was going to approach this.
Right.
I would say, Roger, you know what? Tell me, if I put you on a desert island and said you could not take one of these doses, period, which one would you pick? And you'd say, oh, my first dose is the least important. And I would say to you, okay, here's what I want you to do. That first dose, I don't want you to not take it. For the next 3 weeks, take only half of it on the days that you can. Come back and tell me how it went. That's how I would approach this. Nice, slow, gentle. Talk to a doctor. Don't take my advice. That's just giving you some general.
No, 100%.
Okay.
I have to find another doctor.
And let us know. Parham, do you have anything?
The only thing that stands out to me, and by the way, thank you for calling from South Africa, man. That's really cool. The thing
no problem.
That thing that stands out to me the most is, as a clinician, so I'm a mental health, I'm a alcohol and drug clinician. My question to you would be, back in 2017, when you went to your primary care doctor and you and the doctor decided that this would be a good medication for you to take, what was the reasoning for that at the time? What was the underlying anxiety?
Right. So the underlying trigger was I was on the last year of my bachelor's degree, and it's the final exam. And for some reason that day, I just had a panic attack. I didn't know it at the time. So I went to the casualty ward of the close hospital to me, and then they said, no, you anxious. My heart rate was like 185 or whatever it was. The normal panic attack symptoms. And then that's how they prescribed me. They said, no, you need Ativan. But I didn't know what benzos were at the time. Then she said, no, just take this 90 tablets over 90 days of 1 milligram and you'll be fine. Little did I know that over the course of that time, how it would physically affect the body. Not mentally, but physically. And that's what scared me. Like mentally, now and then anxiety, it's normal thoughts, it comes and goes, but it's not so bad. Where the challenge lies is the physical symptoms that come from the withdrawal. That's what's the hardest part.
Yeah, understood, man. That's a really tough situation that doctor put you in. Because the reason I was asking, just so you know, is I wanted to see if you had a history of anxiety and if you were an anxious, young and growing up, and if there was reasons why you were anxious.
Yes,
but it sounds like it was primarily just a single kind of episodic thing that happened because of the senior year, graduating. Before that,
Yes,
you never had any problems with anxiety growing up or anything like that?
No, sir. Like very slight, like the odd worry here or there, but nothing serious. And then in 2018 and 2019, while I was on the benzos, I was busy doing the MBA, so that gave me more stress. So I think that's why the dose increased.
Okay.
Throughout the course.
So based on that, what I got for you there, Raj, is this Rajiv? Is that how you say it?
Yeah, that's correct, sir.
Okay. So it sounds like whenever you get stressed in life, whenever you have stressors, and it seems like academia was one of it, but here's the thing, man, you're going to start getting them at work. You're going to start getting them in a relationship. You're going to start getting them when your family members get old. You're going to start getting them when the financial markets change. Stress seems like something that dysregulates your emotions to the point that your anxiety increases. So if you want to find a place to really, really go work on, is finding out how to manage and regulate your stress. Even being on the medication and trying to taper down on the medication, that's just one thing. But regardless of that, if you push that aside, you have to learn how to regulate anxiety in a natural way. And if you do that alongside with what Dr. B is probably going to suggest, then you're actually equipped to be able to take on the next stressor. Because guess what, man? Life's going to throw some more shit at you, dude. Life's going to throw some more stuff at you.
I'm glad I got through the MBA now. I'm done with that.
Oh, it's coming, man. It doesn't matter. It doesn't matter. Cool.
Parham, thank you for picking that up. That's a great long advice, because so you got two. So number one, now you know this, and you should absolutely do that, because the coping mechanism should not be meds. But here's the other thing: if every once in a while, like the other day, I gave a guy 2 Xanax. That was the prescription, right? And but so my point is this. If there are those situations, again, I don't know where the hell 90 Advance came from a stressful situation. You establish a rapport with the patient, educate, you got to make sure the mental health is mental health. And then in addition to that, when it's so bad, if it really needed, you give them 5 meds with education, counseling, say, dude, that's it for the month. Don't think that this is regular. And if I see you ask again for another 6 months, no. So Parham, thanks for bringing that out. And Raj,
thank you. Thank you.
Keep us updated, okay?
I will do. I've got your email. I just sent you an email actually through Gmail. So on Facebook with you guys, I'll keep you in touch as best as I can. With
come on, what's going on?
I will. Thank you so much, guys. Thank you very much.
Bye-bye. Hey, bye, Rajiv. I think we got Katrina back. I'm so happy she was on my mind, because I was like, oh, there you are.
Yeah.
I found my webcam.
There you go. There you go. Good.
We can hear you. Talk to us.
Okay, I talked to Nicole, so she's got some of my info, so I was able to do that while I was scrambling, and my webcam's not set up right. Anyways, I've been on 4.5 milligrams of Klonopin for about 3 years, and then 3 milligrams for about 14 years. And I told my doctor Wednesday that I'm in tolerance withdrawal. I have been since December, and he told me it's all in my head and he won't help, and there's no resources around here. I'm disabled. I'm on Medicaid and Medicare, and I have agoraphobia now where I didn't before. I'm sorry. It's just really hard and embarrassing.
No, take your time. Take your time, and it's not.
I lost my mom in '98. It was very traumatic, and they said, here, take this, it'll make you better. And then they just kept upping the doses, and now my dad has cancer, and my husband left me because of the way I am right now. So, and my doctor said that that's why I am the way I am, and I'm not in drug tolerance. So I don't know what to do. And I've been on every forum and support and everything, and I'm just not getting anywhere. and I don't know where to start, if I should taper now or what I should go on to try to stabilize.
May I go ahead, Parham? Let me get this straight. For 3 years, you're on 4.5 milligrams. So you went up 3 years ago?
Yeah, because it wasn't working, but I didn't realize it was tolerance withdrawal until I did a lot of research this time when it started happening again. So I just added more to that I have to go through.
So that worked for a while, but since last December, you're having more withdrawal symptoms.
Yeah.
Huh? And what are those symptoms?
Agoraphobia. I can't eat. I've lost a lot of weight. I needed to anyways. I was kind of chubby. I kind of chuckle to myself. It's the only thing that makes me laugh once in a while. The stress diet. But the brain fog, and I can feel muscle twitches, and I sleep okay, I guess. I just can't get to sleep at night. I take 25 milligrams of Seroquel at night, and the only thing he told me was he wanted to up my Seroquel, and I can't, because if I take any more than 25, it makes my heart race really bad, and it really makes me sick. And I don't even know why I'm still on the 25 of Seroquel, to be honest.
And why did you get onto Klonopin in the first place? What was the issue?
My mom got killed in a fireworks explosion where she worked. And it was really hard, and I didn't know what to do, and they just gave me pills and said that they would make me better, and antidepressants make me really, really hyper. So
before I think this case, before I give you any feedback, I already I think there's some questions we need to ask here, and Parham would do. I think he should lead on the feedback on this stuff, because it looks like there's a lot of issues that were not touched. Parham, I'll let you do your thing here.
Sure. Hi, Katrina.
Hi.
I'm very happy that you were able to troubleshoot your technical difficulties and finally.
Anything for you guys, because I mean, I found Dr. B by accident on YouTube, but I don't think it was an accident. I think it was, and I just been waiting for, him to have this kind of talk. And I'm sorry, when I'm nervous, I talk. Go ahead. I'm sorry.
It's okay. It's okay. I totally understand. And it took you a lot of persistence, and it took you a lot of kind of commitment to make sure that you got back on. So that tells me something about your personality. It actually tells me something that you are you can persevere. You got a lot of perseverance, and you're a tough little cookie. And you're seeking a solution to a problem that you're experiencing. And Katrina, the thing that I felt the most was when you started speaking about your mother in 1998 when she passed away. I felt like you were talking as if something was so close, like in this space between us. I could feel your sadness. I could feel the pain. I could feel the grief, the loss that's unresolved in you. And it was palpable. I mean, I could literally see it in your eyes in front of your computer screen right now. So that tells me as a clinician, like, that has to be addressed. Okay. It's not like it needs to be, because as soon as that happened to you, back in 98, it was so overwhelming for you that you needed at the time something just to help you regulate your emotion. It came in the form of this thing called Klonopin. But guess what that did at the same time? It just pushed away and pushed aside and pushed aside and pushed aside your willingness, your desire, your motivation to actually come work on this thing, right? To address this grief and loss. And as you kind of continue to move forward in your journey, other things have happened, whether it's your father getting ill or being disabled, being unable to work, your husband not being able to handle the situation going on with you right now. These are all very important stressors, life stressor events that I'm telling you this. I'm not going to be ever as desensitized to a human being's emotions like your physician telling you that it's all in your head. I'll never tell you that, because that's not my place to say that to you, right? But I will tell you this, that a lot of the stuff that you shared with us has a lot to do with a lot of the feelings you're also experiencing. A lot of it. I can sincerely say that it's not just the dose, and it's not just the medication going from 4.5 to 3 or whatever it was. It's also all of this, because Wayne Dyer is one of my favorite people. He says, if you squeeze an orange, what comes out, right? And the answer to that, Katrina, is orange juice. And if I squeeze Katrina, what comes out? And it's all of that sadness and all that pain and all of that you have inside of you. If you don't find a way to process all of that, the Klonopin's not the answer. It just isn't. The right dose of Klonopin isn't the answer.
I don't even want to be on it anymore. And that's my thing is I want off of it. I want away from it so I can think clearly, because it's given me all these, I've never been afraid to walk to the mailbox. I bought a watch to check my heart rate because it goes up so much, and I'm 43. I'll be 44. I don't want to have a heart attack. I think I'm always going to have a heart attack. I'm going to die. It's just a lot. And I want help. And, and every therapist I've been to, it's always, nobody has ever talked to me about my mom. It's always, other things. And they never, it's like this county that I live in is just so terrible for any kind of help like that, any kind of grief or any, counseling or anything like that. I mean, I was 21 when she passed, and I was the oldest of 4 children. So, and at the time I had a child myself when I was 17, and Child Protective Services had stepped in because I was making some poor choices. And I lost her a year after that to the state. So, and I have 2 other children. So, I mean, yeah, I've been through a lot, but I mean, I just want, Klonopin out of my life. I don't feel like, medicine's not helping me be able to deal with what really happened with my mom or what really happened with my child. And I don't have the emotions that I used to have. I feel like I'm a shell of a person.
Katrina, the stuff Parham said, I look at this situation as far as building tolerance to this stuff. It's a little bit theoretical, but there's this concept called the decoupling effect, which has to do with 2 different parts of the receptor. That's not so important. What's important is this. This stuff does that anyway. In your case, the pathways affected are the pathways that already needed to be addressed through mental health. So if I could say it, I'm trying to express something. If anything, the situation, the way I look at it now, kind of globally, is that the medication exacerbated the issues, right? Because those things that needed healing kind of went off the rail by the medication. So let me ask you this. Parham mentioned earlier, there's for everything, there's telehealth services now after COVID, including therapy. And I'm sure you have the local Medicaid over there. Is that what you said?
Michigan, yeah.
County. Are you able to utilize it to?
I'm not certain. I don't know. Honestly, I've looked into, online therapy and stuff, but I haven't really been able to find anything. I don't know if I'm looking at it wrong or whatever, but yeah, I know I do need to, and I know I need to get out of the house, and I know I need to, face my fears of, but when my heart rate goes up to 130 just to go to the mailbox, I mean, there's something, wrong with that.
Okay, here's my fear. I always try and think, what could Parham and I give you? We can educate you a little bit on things. I always want us to leave you with some kernel so you can do something about it, even in this space that him and I are operating in, which is very constrained. And here's what I want to do. So we know you need good mental health care. I also know that you need a clinician that understands, because, potentially, I would actually up the dose, stabilize you, get you good mental health, follow you weekly, and then start shaving in a month to 2 months. That would be one possible thing I might do with the patient. Who knows? But what do we know here? Parham gave you something, I gave you something. So let's chop it up. You have some agoraphobia. It seems like there's all kinds of panic attacks, panic anxiety syndrome. So why don't we do this? Let's give you an assignment, okay? Your assignment, and my suspicion is Parham can refine this better than me, because your assignment for this week, one task, Don't overwhelm yourself with shit, whatever that's going on. I don't know if there's all the other stuff, but as far as your mental health, your medication, I'm going to give you one assignment. Figure out what additional resources are available to you through the county and the state. You have, we know you have internet, right? And we know sometimes government services suck. That's okay. I can tell you this. I've worked at the VA, and everyone thinks VA sucks, but some of the best physicians are at the VA. The system sucks. In that same sense, you can potentially access some really good care. So that's my only assignment for this week is figure out mental health and a clinician. And if it doesn't work, here's the beauty of it. The next day you can try it again. That's my assignment for this week. Parham, if you can make this, if you have something to add to make this better, it's all the better. And then she can come back and tell us.
Yeah, no, that's a great suggestion. And it's a nice takeaway. And I hope, Katrina, you take that with you. And sometimes a good place to start, by the way, for grief and loss that I've noticed. I mean, I know the resources are different, but the local hospital. Sometimes the social workers in the hospital, because there's so much loss that happens within the hospital system, they usually have at least a phone number or two that's local to you that you'll be able to kind of go there. And here's the thing. I know you think that your loss happened in 1998 and you sitting in a support group with a bunch of people that just lost people last week or last month is completely different, but I promise you it's not. The loss is the same. You know, the only difference is this thing called time that happened between then and now. And for you, that time is really, really fresh. So there's no difference between it. So access whatever you can, take doctor's suggestion, come back and talk to us. You know, little things go a long way. Don't ever forget that.
Well, I'm supposed to talk to my doctor in a week, and he said he'd check on me in 2 weeks, and I don't even know what to say to him because he clearly, you know, doesn't. I mean, it's like I want to be stabilized, you know, and I don't want to go up on my dose, but I have thought about, you know, asking him please just to get me stable. I just want to be stable enough to do this stuff. I mean, I just feel like there's just so much anxiety that I can't get anything done. You know, my neighbor's like, you want to go for a walk today? And I started to, and I just freaked out, almost passed out. It's like, that's how bad it is.
I think, excuse me, I think what you should do when you see him is be honest and see what how he comes back at you. Be honest. That you have to give him your complaints. We call that a chief complaint. Right? What is the person here? And be honest. Say, look, the global situation sucks, and I'm just getting worse. Please help me, guide me through this if you can. And you know, try to build an honest rapport. And if there's a disassociation, let that be professional and based on very humanistic engagements as well. Try that. And try what we said and let us know what's going on. Keep us updated. We'll support you through here as best as we can.
Okay, well, I appreciate it so much. I didn't think in a million years I'd be able to talk to you. And I really just, you don't know what it means to me. It's just like, it's a breath of fresh air to be able to talk to someone that actually knows what they're talking about. When you live in a town like I do, like the other guy, they said it's a meth town. It's a meth town here too, and my husband's on it, and that's part of the reason why you know, when he left, it's like he has no emotions either. So yeah, it's a really rough county that we live in. But I don't want to take up a bunch of time. I'm so very sorry, but I really just wanted to talk to you, and
we think you can get through this. Again, it's not going to be overnight.
No.
Right? But the you know, the road itself is the discovery and the joy. So we'll support you and we'll keep guiding you. Okay.
The last thing, Katrina, I want you to actually, as a homework assignment, go read all the side chats from the time you came on. There are people that have no idea who you are. They're not from the town, and they're giving you so much love and support, and they are validating you as a human being. They're having a lot of compassion for your journey and your loss. So I want you to see that this support's available to you here too. So maybe go back and maybe send some messages to those people and use this momentum you have right now to break you through the next day.
Absolutely. And yeah, thank you for pointing that out, Parham. And if you see Nicole on there, She's got great on Real Talk Recovery. She's got a lot of stuff going on now. I don't even know, but she has these amazing groups where people. It's just so fair. She's built a very unique, progressive, and I think some of it is first of its kind therapeutic online communities. Hook up with her. She will plug you in. I've never had a person regret hooking up with Nicole and the therapeutic communities that she's built. And
yeah, I definitely would join an online community because that's the only thing I really can do right now. I mean, because I have to baby step it, and with COVID being the way it is and stuff. So yeah, I definitely will. And thank you guys so much for all your support. And I really appreciate it. You know, that I feel like a human being after I talk to you guys and not just like, you know, a paycheck. So thank you.
Our pleasure. Okay.
Goodbye.
Bye, Katrina.
Bye.
Wow. Hey, let me just tell some. Hey, guys, on TikTok, I saw a couple of VA things on there. And as I was trying to say, I think the VA is a great system. I just loved working there. In fact, one place I would go back to is the VA, and there's amazing doctors. There was a lot of bureaucratic red tape and crap there, as you guys all know. I noticed someone saying their mom is a higher up at the VA. Tell her to fix this stuff for all of us. Wow, what a great day, huh?
Wow, yeah, that was amazing, man. That's and you know the side chat is so engaged and interactive, and this is great. You know, one thing I do want to do, Doctor, I think we can make this a part kind of moving forward, and I don't know what people think about this, but when we have someone calling from different parts of the United States or the world, I think a question we could ask them just as a fun thing to do is, what's one thing that nobody knows about, you know, where you're from that you would like them to know? You know, I think it would provide a little bit of a different angle to the talk and give a little bit of culture to everybody. You know, whether it's the United States, a different town, every state to state's different, and there's a lot of unique characteristics that people don't know about. And I think it'd be a way to kind of educate people on a level that's in addition to what we already do.
That's a fantastic idea, because if I was left to my own devices, I'd start asking them questions to educate myself. And you know, that's great, because one of our whole endeavors here is, you know, and I know you shared its view. I think education is empowerment. It's a tool that allows you autonomy, free will, and it's something nobody can take away from you. And what you just added to that just sort of adds to that, and I love that. I love that idea. And this one is for the TikTok folks. For a lot of you out there, you know, what Parham just mentioned is if you go through the comments of some of the posts I put up, a lot of your questions are even answered in the comments. The discussion generated in the comments is extremely insightful to your question and your position and thought on this. So create communities all around of support and education. Yeah, I love that, Parham. What are we going to do next week?
Let the people talk, I guess. I do want to do, when we get closer to June, I want to do something about Anthony Bourdain that we promised we're going to do.
Yeah, I would love to do that. I love Anthony Bourdain, and I think that would be really good. A lot of people came, and I think you're right. There's a lot of stuff on the side there. I saw a lot of questions on there, and I think on a TikTok too. Hey, TikTok guys, if you just came on, we're almost done here, but I can't read this and that at the same time. Go on the channel. This is every Sunday, 1:45 p.m. Me and Parham Namatola, and we pick a kickoff topic to discuss, but we're open to all questions. We probably had, how many did we have? Like 8 or 9, 7, 8, 9 people.
Great.
Yeah.
Great. Yeah.
And it worked out well with the timing. So we'll do this again. We didn't see Nicole. She didn't say hi, but I see her out there. Nicole, you got anything to add? I don't know if she does. She's not on there. Any parting thoughts here, Parham?
No, I just want to continue this momentum that we built. I mean, this show would mean nothing if it wasn't for everyone that comes in and contributes, whether it's on the side chat or jumping in video. Dr. B and I can talk for a while, but it's just our personal opinion. But when you guys bring in your human touch to it, it provides a opportunity for us to use our expertise and our experience. So I think we got Nicole. Let's finish up with her, right?
Hey, Nicole.
What's up?
There you go.
I look crazy right now, so y'all don't judge me. But I just want to let everyone know in the chat, listen to me, okay? I was addicted to eating probably 10 to 15 Xanax bars a day for years, over 10 years. And I got off of them 5.5 years ago, and I'm living life. I don't have any withdrawals that I can realize from benzos anymore. I was on multiple substances, meth, opiates, all kinds of different drugs. But I want you guys to know that it took time. And it was about 8 months after I got completely off of benzos to where I started feeling like a human being again. But what has helped me so much is utilizing support. Like, I am online live streaming, talking to people about my situation, what I'm going through in my life in present day, what I've went through in my past. And it might seem like such a little thing, but it has changed my life. It has saved my life having other people to relate to that have been through what I've been through. So I just want to give you guys encouragement that you guys can get off of whatever you're trying to get off of, benzos, opiates, whatever it is. And I also want to say, it's okay if you need medication, okay? And if you choose to stay on your medication for the rest of your life, there's nothing wrong with that either. So we support you either way. And you can call me on the 1-800 number that I list in the chat. I always answer it. If I don't answer it, it's most likely because I'm either in the shower or on the other line with somebody else who called. Leave me a message with your phone number or text me, because I list my cell phone number on the message, and I will call you right back. Okay?
Yeah, Nicole is a tireless advocate, and she literally doesn't get tired, and she just goes at this. And she herself has been responsible, I think, for so many people. People think, people come to our programs. No, Nicole's out there talking to people anywhere they are. She's and I sometimes have to hold Nicole back. I'm like, Nicole, you don't have time to do that. She's looking up social services, getting them in their state, all that stuff. So yeah, Nicole's a rock star, and you guys reach out to her, please.
Bye, Dr. B. Thanks, you guys. Love y'all.
Bye, Nicole.
Hey, on TikTok, guys, and YouTube. Bye, Nicole. YouTube, don't forget, Parham has his own channel. He has them on both. The 1 Minute Therapist, is it still called that, Parham?
I believe so, yeah.
On both?
Though my Instagram, the 1 Minute Therapist on Instagram is probably where I'm the most active, but I'm on YouTube. It's the 1 Minute Therapist. And anytime here with Dr. B, you can find me available, accessible. I'm always trying to interject myself when and where I can. So really grateful to have this opportunity.
No, and it's a pleasure for us to have him. So don't forget Parham. He's quite a wrecking ball out there, at least down here in Southern California, Orange County. Parham, I'm going to shut us down, I think.
Okay.
It was great. I'm going to YouTube folks and TikTok, please subscribe, like. If you want, we have a very reasonable Patreon account. We really want to develop this stuff for big time for you guys. So we appreciate your support in any way. And let me end the broadcast. Thanks again, YouTube. And I saw a lot of familiar faces out there. Let me end that. Okay, that one is